I'm with Dr. Julianne Garrison from CU Medicine Family Medicine Park Meadows. February is American Heart Month, a time to focus on your cardiovascular health. So I wanted to talk to Dr. Garrison, get some tips to take care of our hearts. First, what are some of the risk factors that can lead to heart disease or problems with our heart?
I think many of us know that diet is extremely important. Hippocrates said, let food be thy medicine and medicine be thy food. And I think that really is the very first place to begin. We know that the foods we put into our body can create inflammation or reduce inflammation. We know that they help foster the types of bacteria we grow in symbiosis in our guts and in our skin and in our hair and in our bodies. And those bacteria help keep our heart healthy. We know that good dental oral hygiene is important. We're learning more and more about how seeing your dentist regularly, having good oral hygiene makes a difference in heart health. We know that exercising is probably the most important pill we would put every person on if it could be prescribed, or if you just make it a daily part of your routine. It's extremely important not only for heart health, but also for memory, concentration, focus, mental health, and ultimately for Alzheimer's and dementia prevention. Let's see. Yes, getting regular checkups where we're keeping blood pressure well controlled, where we're keeping cholesterol, at least watching it and controlling it if we need to. And then ultimately working collaboratively with a primary care physician so that we're making sure we screen and prevent and treat, if necessary, any conditions that, like high cholesterol, that may lead to heart attack or stroke on down the line.
What are some of the other indicators that your patients may be at risk of heart disease?
Yeah. So we know that persons who live in a way that is universally considered healthy are healthier and less likely to have a heart attack or stroke, even if they have a high risk with regard to their family history. For example, persons who exercise regularly, people who eat a heart healthy diet that's high in fruits and vegetables, especially green leafy vegetables, and lower in animal proteins and fats. Those persons tend to be healthier over the long term. We know that persons who don't smoke cigarettes or vape, that persons who maintain a healthy body weight, persons who try to manage and reduce stress, those persons tend to do better in the long term. Lastly, and to speak to family history, there's some cool truths about family history. One is that we can use family history as a bit of a crystal ball to give us a guidance about things we should consider for individuals. For example, if a person has a parent who had a heart attack or stroke under 55 years old, it means that we probably need to be extra careful with that person. However, if a person has a family member, as I do, who had a heart attack or stroke under 55 years old, that doesn't have to be a crystal ball. For example, we know that certain types of genetic testing for cancer, if you have a gene for cancer, it might show that you have a 60% chance of having that type of cancer. Kind of scary if you have that gene. But what about those 40% of people who have the gene and never get cancer? It was super cool when we shifted our perspective and started to look at those folks and what they're doing and how it prevents cancer over the long term. We can do the same thing and have done with heart attacks and strokes. And we know that genetics are just the tip of the iceberg. 90% of an iceberg can't be seen above the water, only the tip. 90% of what determines whether you get a heart attack or stroke can likely be determined by the way and manner in which you live your life.
What are some ways you try to motivate your patients to implement some lifestyle changes to help take care of their heart? You mentioned exercise. Do you give them a prescription of 30 minutes a day? What are some kind of ways you motivate them?
I really think you meet people where they are. If someone's drinking 2 liters of soda and they have a lot of shame about that, I'm not going to start talking to them about 30 minutes of walking every day. I'm going to ask them what they think they can do, because here's what we know. Whatever you think you can do, just pick one thing and keep doing that thing and make it a habit. And when it's a habit, let's work together to find what your next thing is. When we try to build Rome in one day, we get overwhelmed and Rome can collapse. So I tell my patients, let's see where we can start. And I have them identify where that is. It's different for everyone.